Hey everybody, welcome back to Psychic Spark. In today's subject, we will discuss sleep apnea, causes, symptoms, and treatment options. Make sure to subscribe to the channel so we can give you the best psychological tips regularly. Now, let's get into the video. The common sleep disorder known as sleep apnea is characterized by frequent breathing pauses while you're asleep. Despite its prevalence and potential serious health consequences, sleep apnea often goes undiagnosed and untreated. Understanding this condition is crucial for individuals and healthcare professionals alike, as it can significantly impact quality of life and overall health. In this comprehensive guide, we delve into the intricacies of sleep apnea, exploring its causes, symptoms, and available treatment options. By shedding light on the underlying mechanisms, risk factors, and diagnostic approaches, we aim to empower readers to recognize the signs of sleep apnea and seek appropriate evaluation and management. Join us on a journey to unravel the mysteries of sleep apnea and learn how to address this common yet often overlooked sleep disorder. Number 1. Understanding sleep apnea. Sleep apnea encompasses a spectrum of sleep-related breathing disorders characterized by pauses in breathing or shallow breaths during sleep. Obstructive sleep apnea, OSA, and central sleep apnea, CSA, are the two primary forms of sleep apnea. OSA, the most common form, occurs when the throat muscles relax and block the airway, leading to repeated breathing disruptions. In contrast, CSA occurs when the brain fails to send signals to the muscles responsible for breathing. Sleep apnea affects individuals of all ages and backgrounds, but certain factors increase the risk of developing the condition. These risk factors include obesity, older age, male gender, family history, smoking, and anatomical abnormalities in the upper airway. By understanding the underlying mechanisms and risk factors associated with sleep apnea, individuals and healthcare providers can better recognize the signs and symptoms of this disorder and initiate appropriate evaluation and management strategies. Number 2. Causes of sleep apnea. Sleep apnea arises from various physiological and anatomical factors that disrupt the normal breathing pattern during sleep. In obstructive sleep apnea, OSA, the airway becomes partially or completely blocked, leading to breathing pauses or shallow breathing. This obstruction can result from factors such as excess weight, enlarged tonsils, or a narrow airway. Central sleep apnea, CSA, occurs due to a dysfunction in the brain's respiratory control center, causing irregular breathing patterns during sleep. Risk factors associated with sleep apnea include obesity, advancing age, male gender, family history, and certain anatomical features, like a recessed chin or large neck circumference. Additionally, lifestyle factors such as smoking, alcohol consumption, and sedative use can contribute to the development or exacerbation of sleep apnea. Understanding the underlying causes and risk factors of sleep apnea is crucial for accurate diagnosis and effective management strategies to improve sleep quality and overall health. Number 3. Symptoms and complications. Sleep apnea manifests through various symptoms that can significantly impact an individual's well-being and daily functioning. Common symptoms of sleep apnea include loud snoring, choking or gasping during sleep, daytime sleepiness or fatigue, morning headaches, and difficulty concentrating. Additionally, individuals with sleep apnea may experience mood disturbances, irritability, and decreased libido. Sleep apnea can cause major health issues if left untreated. Chronic sleep disruption can increase the risk of hypertension, heart disease, stroke, and diabetes. Moreover, sleep apnea has been linked to cognitive impairment, including difficulties with memory and concentration. Untreated sleep apnea can also exacerbate existing conditions such as depression and anxiety. By recognizing these symptoms and potential complications, individuals and healthcare providers can take proactive steps to diagnose and manage sleep apnea effectively, thus reducing the risk of long-term health consequences and improving overall quality of life. Number 4. Diagnosis and evaluation. Diagnosing sleep apnea involves a comprehensive evaluation of the patient's medical history, symptoms, and sleep patterns. Healthcare providers may utilize screening tools such as questionnaires to assess the likelihood of sleep apnea. However, the gold standard for diagnosing sleep apnea is a diagnostic sleep study known as polysomnography. During polysomnography, patients are monitored overnight in a sleep laboratory, where various physiological parameters are recorded, including breathing patterns, oxygen levels, heart rate, and brain activity. This comprehensive assessment allows healthcare providers to accurately diagnose sleep apnea and determine its severity. In some cases, portable home sleep apnea tests may be used as a more convenient and cost-effective alternative to polysomnography, particularly for individuals with a high likelihood of moderate to severe sleep apnea. Prompt diagnosis and evaluation of sleep apnea are essential for initiating appropriate treatment and reducing the risk of associated health complications. Number 5. Treatment options. Treatment for sleep apnea aims to alleviate symptoms, improve sleep quality, and reduce the risk of complications. The most appropriate treatment option depends on the type and severity of sleep apnea, as well as individual patient factors. 1. Lifestyle modifications. Weight loss, avoiding alcohol and sedatives before bedtime, and positional therapy, sleeping on the side, can help alleviate symptoms, particularly in mild cases of obstructive sleep apnea, OSA. 2. Continuous positive airway pressure, CPAP, therapy. CPAP therapy is the primary treatment for moderate to severe OSA. It involves wearing a mask connected to a machine that delivers continuous air pressure to keep the airway open during sleep. 3. Oral appliances. Dental devices that reposition the jaw and tongue may be recommended for individuals with mild to moderate OSA who cannot tolerate CPAP therapy. 4. Surgical interventions. Surgical procedures such as uvulopalato-pharyngoplasty, UPPP, or maxillomandibular advancement may be considered for select cases of OSA. 5. Alternative therapies. Inspire therapy, a surgically implanted device that stimulates the airway muscles during sleep, and positional therapy devices may be options for individuals who cannot tolerate CPAP or oral appliances. Individualized treatment plans should be developed in collaboration with healthcare providers to ensure optimal management of sleep apnea and improvement of sleep-related symptoms. Number 6. Management and prognosis. Effective management of sleep apnea involves ongoing monitoring, treatment adherence, and lifestyle modifications to optimize sleep quality and overall health. Adherence to prescribed treatments, such as CPAP therapy or oral appliances, is crucial for symptom improvement and prevention of complications. Regular follow-up appointments with healthcare providers are recommended to monitor treatment efficacy, adjust therapy as needed, and address any concerns or challenges. The prognosis for individuals with sleep apnea varies depending on factors such as the severity of the condition, the presence of comorbidities, and treatment adherence. With appropriate management, many individuals experience significant improvement in symptoms and quality of life. However, untreated or poorly managed sleep apnea can lead to persistent symptoms, increased risk of cardiovascular disease, and other health complications. Therefore, proactive management and ongoing support from healthcare providers are essential for optimizing outcomes and reducing the long-term impact of sleep apnea on health and well-being. Conclusion understanding. Sleep apnea is essential for improving diagnosis, treatment, and overall management of this common sleep disorder. By recognizing the causes, symptoms, and available treatment options, individuals and healthcare providers can work together to address sleep apnea effectively. With timely diagnosis, appropriate treatment, and lifestyle modifications, individuals can experience significant improvement in sleep quality and overall health. Continued research and education in the field of sleep medicine will further enhance our understanding of sleep apnea and help develop innovative approaches to its diagnosis and management. Let's prioritize sleep health and empower individuals to achieve restful, rejuvenating sleep.